Hello. Welcome back to Wednesday Walk and Talk. I hope you've been doing well. We have had a little change in scenery. Opals with me again. I know it's been a couple weeks since I've actually been out and being able to do some walking and talking, but we have snow on the mountain, as you can see. So you can't see much of the view, but this is how much snow we got last night. We probably got like an inch and a half or so. It's pretty wet. First snow of the year. It was very surprising when we woke up this morning. We're not expecting it quite so soon. So here we go. This is technically not Opal's first snow because she was born in March. So she has seen snow before, but I think maybe this is the first time she's like processing it. I don't know if she can quite really figure out what is going on. So this is kind of fun. I was really excited to bring her out in this today and do a little walk and talk. Okay, so let's get down to it. This week, I wanted to talk to you about imaging and first of all, what that is, what it means, and how to use the results from your imaging. So imaging is anything from like x-rays to MRIs to CT scans, basically anything that takes a picture. Ultrasound imaging is another big one. It's basically anything that takes a picture of an affected area. So it's pretty cool technology. I mean, you get to see your insides without cutting you open. And with things like ultrasound imaging, you actually can see how certain muscles or tendons are moving while you're moving, which is pretty cool. Here's the thing with imaging, and this is something that I'm sure if you've had chronic pain for a long time, that you've had at least one type of imaging, whether that be an x-ray or an MRI. Those are the most common, right? So at least for musculoskeletal issues, so things like joints, bones, ligaments, muscles, tendons, all those things, imaging is really, truly, primarily just a piece of the puzzle. And this is really the case for other types of imaging too, like CT scans and things like that. These are mostly still images that you're usually laying down for, maybe you're sitting up for. They have to get you in certain positions to be able to get optimal image quality and being able to see what they want to see. But some of these positions might be, one, really uncomfortable for you to be able to be there for a long time, or two, these might be positions where you don't actually have pain in. So that's something to keep in the back of your mind. So imaging is basically just a snapshot or a moment in time. It's kind of how I like to talk about it. It's kind of how I like to introduce my clients to this. And here's the deal. It is important. It's a really cool tool. We can really see if there are things going on or if there aren't structural things going on. But the deal is, it's not the whole picture. And I think when people get imaging results, they look at this and think of it as like the whole picture, basically, right? And that's just not the case. And if you take your imaging results and either get very discouraged because there's nothing wrong on the imaging results, or you get very scared or fearful or anxious because there are a lot of things wrong on the imaging results, even in places where you didn't think you had pain in, just take a step back and remember, this is simply just a snapshot in time. And here's the secret with imaging. If you've had positive imaging results, and by positive, I mean anything that's, away from the norm, just remember, these results are normally read, the reports are normally written by doctors who don't know anything about you or your history. Their job solely is to interpret the image. Their job is not to put the image together with your symptoms. So I get a lot of people who get really frustrated when they come in and they say, I've had an MRI and there's this, and this wrong with me. It sounds horrible. There's like degenerative discs, there's bulging discs, there's maybe even herniated discs, there's just stenosis, slippage, whatever. But my doctor told me there's nothing wrong. Obviously, there's things wrong. But remember, if you're going off the report, the typewritten report itself, it is from somebody who's never met you, potentially not read your history, and their main job is just to interpret the image. Your job of your doctor or your primary care physician, and even potentially your physical therapist or what have you, they're supposed to put the big picture together. So, for instance, if you have had back pain on your right side for a very, very long time, and that's your chronic pain area, but then you go get imaging and you actually have bulging discs on your left side, what's the deal there? Are those discs a part of the problem? Are they causing your pain? Honestly, I can't give you that answer, but that is something to talk to your physician about and talk to your physical therapist about. Many times you will have positive imaging results that actually have nothing to do with your pain. So why is that, you might be asking? Like, what's the point of imaging then? Well, imaging really is, first of all, to make sure that we are crossing all our T's, dotting all our I's, making sure there's nothing, really bad going on that does need surgery, right? But if your symptoms do not match up with your image, just remember, most people are going to have positive imaging results. In fact, there was a study done by a group of chiropractors, probably like 10 years ago now, where they did MRIs of people's spines, of two groups of people. One group of people had no back pain, like, they would have maybe aches and pains a little bit, but nothing that they would see the doctor for or anything like that. So those were your like normal group. And then they did imaging studies on people with chronic low back pain. And guess what? The results are that the amount of positive incidences of issues with those MRIs were equal in both groups. I know, Opal, it's surprising. I was surprised too. I know. So what does that mean? Basically, people with no back pain, with no pain at all, can actually have structural things going on with them. And those structural things are not causing their pain. So remember, the way pain works is a biopsychosocial trifecta. So yes, your biology does impact your pain experience. So if you do have a traumatic accident and you tear something, that's going to cause your brain to be like, yes, there's something wrong here. Pay attention, hence generating a pain signal, right? But if you had chronic pain for a long time and you had a traumatic accident, maybe 5-10 years ago, and that pain has lingered, flares up randomly, it doesn't really follow any movement pattern or anything like that, that pain might not have as much contribution from the biological side. But that pain might have a little bit more of a contribution on the psychological, emotional health, well-being, your impression of the pain, your impression of how that injury affected you in your life, and maybe some emotional and mental things that you have to work through to help yourself move on from that accident and then from the pain. So, the moral of the story here is that imaging is great. I never discourage people from getting imaging. And some people, they need it, even though they're like, I don't think there's anything wrong, but they need it for almost like a mental closure. Like, I just want to make sure that there's nothing wrong. In that case, if your insurance covers it and your doctor orders it, 100% go for it, right? But just remember, take everything with a grain of salt, or take those imaging results with a grain of salt. If there's nothing wrong, that doesn't mean your pain isn't real, okay? if there is something wrong, that doesn't mean that what is wrong on imaging results 100% correlates with the amount or location or type of pain that you've been experiencing. Remember, it is just one piece of the puzzle. So I hope this helps clear up some thoughts and feelings that you might have about getting imaging, or understanding what imaging is and how you can really use imaging as a tool for yourself along your healing journey. Thank you again for coming to another installment of Wednesday Walk and Talk. I hope you have a fabulous rest of your day and week until next Wednesday when we meet again. And Opal is absolutely transfixed by the snow. She is quite bundled up underneath, but I didn't throw a hat on her. So next time we'll have to put a hat on her. Great. Have a fantastic week. We'll see you next time. Bye.